Hello friends, welcome back to Fitandyou. In continuation to our episodes on anatomy, we are presently doing episodes on all the muscles of leg anatomy. In the first episode, we covered iliopsoas muscles. In this episode, we would cover three different muscles. First, Tensor Fasciae latae, ILIOTIBIAL tract, and third, gluteus maximus. Second, all the major functions of these three muscles. Third, we would learn how to stretch these three muscles. And fourth, we would learn how to strengthen these muscles by exercises. Now, we will study what are TFL, the ITB tract, and the gluteus maximus muscle. First, the muscle Tensor Fasciae latae or TFL muscle is the muscle of the outer thigh. It lies in the front of the gluteus muscle at the upper and outward area of the thigh. It arises from the anterior part of the outer lip of the iliac crest. It is inserted along the iliotibial tract. Second, the iliotibial tract or ITB tract is a thick band of fascia that extends along the lateral thigh from the iliac crest to the knee. The ITB band is inserted into the lateral condyle of the tibia. Third, the gluteus maximus originates from 4 different points and inserts into 2 different points. It originates from 4 different points, which are: first, the sacrum torso part of the pelvic region shown in the picture in orange color. Second, the ilium behind the posterior gluteal line of the pelvic region shown in blue color of the picture. Third, the sacrotuberous ligament of the pelvic region shown in red color of the picture. And fourth, the thoracolumbar fascia of the lower back region shown in light blue color of the picture. The gluteus maximus inserts into 2 different points. Its upper part consists of caudal fibers which inserts into the gluteal tuberosity. Its lower part consists of the cranial fibers which inserts into the ITB band. Now, we will study the functions of TFL, ITB tract and the gluteus maximus muscle. First, the TFL muscles. The TFL flexes the thigh on the pelvis. It helps the leg to move forward and simultaneously pushing the body backward. So, if a person is walking backward, this muscle is coming into play. TFL helps in medial rotation of the thigh from midline towards the inside in an anti-clockwise manner for the right hip, simultaneously rotating the body in a clockwise manner. For the left hip, medial rotation happens in a clockwise fashion and it pushes the body to rotate in an anti-clockwise manner. Second, the ITB tract. The ITB tract abducts the thigh on the pelvic. So, if a person is raising the leg sideways, this muscle is coming into play. It stabilizes the pelvis and helps it return to its original state. Means, if one side of a hip gets depressed, it helps it to retain its horizontal position. Just a thought. So, of course, the belly dancers would be requiring a strong ITB tract, right? Okay. Just forget it. Now, coming to the point, the gluteus maximus. The gluteus maximus extends the thigh on the pelvic. It helps the leg to move backward and simultaneously pushing the body forward. So, if a person is walking forward, this muscle is getting used. It helps in the lateral rotation of the thigh from midline towards the outside. So, we now realize that the function of both the TFL and gluteus maximus are opposite to each other. Their combination helps us to move forward, backward, clockwise and anti-clockwise. The ITB stabilizes the hips and the knees and helps the side leg raises. Now we will learn about the injuries and its prevention by stretching. If your ITB tract and TFL muscles become rigid and loses their flexibility, then the ITB band will slide over the greater trochanter, causing a snapping noise. This syndrome is known as the snapping hip syndrome and is very painful. Question is, how you will know that you have this syndrome? Answer is, lie on your side and move your top leg backward. Then rotate the leg. If a snapping sound comes, you have the snapping hip syndrome. You can prevent this injury by increasing the elasticity of your TFL muscles and the ITB tract. This can be done by stretching as shown in the next figure. Take a chair or lean against a wall. To stretch one side, you need to put that side of the leg behind the other leg and then push sideways with your hip with the intent to touch the chair or wall with your hips. Hold on for 30 seconds. Repeat 3 times. Now for the gluteus maximus. If your gluteus maximus is tight, it will start pulling its point of origin of area of the thoracolumbar, which is in the lower back area, and will cause lower back pain. It will also start pulling its point of insertion on the ITB tract and will result in overworked ITB band. The question is, how you will prevent it? Answer again. As usual, you yourself can prevent this by stretching your gluteus maximus. Lie down on your back. Cross one leg over the other and pull the knees with your hand. Hold for 30 seconds. Repeat with the other leg. Do 3 such sets. Now we will know about the strengthening exercises for the TFL, the ITB band and the gluteus maximus. First, for the TFL and ITB band, do side leg raises with your foot rotated towards the outside. Do 3 such sets of 15 repetitions each leg. Then for the gluteus maximus. For the gluteus maximus, do hip thrusters. As shown in the figure, lie down on your back at the edge of a bed or sofa. Keep your back, neck and head straight. Remember, it is very important to keep all the 3 things in a very straight line and don't do any curvatures over there. Then push your hip in a thrust fashion. With the thrust, you push the hip with a thrust upwards and then bring it down slowly. Complete 15 such repetitions. Do 3 sets of 15 reps each side. Okay, so now friends, we have finished up with this topic. So please keep watching and kindly subscribe and push the bell icon to get instant notifications. Always remember, we are here only for you. Remain fit. Goodbye.